All right, guys, I think we're set. We were able to get our colleague with the interpretation. So thank you so much, everybody, for joining us this evening. We're gonna get started. Para las personas que están entrando al español, la sesión va a ser completamente en inglés, pero pueden escoger el icono que tiene el mundo o el globo y que dice traducción o interpretación. Si no lo ven en su pantalla, pueden hacerle clic a los tres puntitos que dice more o más y baja un menú donde van a ver ese icono o dice traducción o interpretación. Háganle clic y van a oír la voz de nuestra compañera Sara que va a estar haciendo la traducción. All right, guys, thank you so much. I was just giving directions for those folks that are going to need interpretation to Spanish for this afternoon's session. So again, thank you so much for joining us, for giving us an hour of your day. I know it's been a busy week, so we thank you for joining us. My name is Berenice Pan. I am one of the FACE managers for Chicago Public Schools, but I'm also a parent. My son attends a Chicago Public School, so a lot of the questions that you guys might have, obviously I have too. So we're going to have a conversation today about some of those questions you guys have. So just a couple of things before we get started. Do note that we're going to be recording this session and that we do that in order for the parents who are not able to join us to see it at a later time. So we do upload it to our YouTube channel so you guys can see it. And we also are going to have a short presentation just to give you an overview of the topic for today. We're going to get started with the conversation with Chief Stokes, and then we're going to ask the questions that you guys submitted ahead of time. So just know that that's what we're going to start with when we start the conversation with them. The chat is not going to be open the entire time. We're going to open it 15 minutes prior to the ending of this session. And please also know that we might not have time to get to those questions. So hopefully we'll answer as much as we can in the hour that we have. If we're not able to answer your questions, we're going to have them in the chat, and then we're going to try to put a Q&A together to answer some of those questions, and we'll send you links and those type of things after our session tonight. Okay. Perfect. So today topic, you're with us at Ask the Experts. It's part of the face-to-face Family and Community Engagement Department programming session, virtual sessions. And today we're going to talk about how has CPS prepared to bring back the pre-K students. So that's the topic for today. I know some of you guys might have other questions about reopening, and just know that we have other, we're going to have other sessions with those questions might be answered. Which leads me to this. These are upcoming sessions that we have. We have Dr. Fox next week, and then we have Chief Clarence with us. We're scheduling more. I know towards the end of the month, we're going to have Chief for ODLSS. So just stay on our mailing list, and we'll send out those invites and those reminders so that you guys sign up. And when you're RSVPing, put your questions down so that we get them ahead of time, and we can try to get them in as much as we can when we're talking to the chiefs. And today's speakers, without further ado, we have today is Chief Bryan Stokes from Early Childhood Education. You guys can see the bio on screen. So just know he comes from a teaching background, right, with early childhood, and also has helped us in CPS develop this free universal pre-K for all students in the Chicago public schools. So he comes with a lot of experience. Obviously, he's taught our little ones, so he has our best interests at hand. I'm going to let him introduce himself a little bit more because he'll do better justice than what I'm doing. So Chief Stoke, thank you so much for giving us your time, and appreciate you coming in. I'm going to stop sharing my screen so you can share a little bit about yourself.
Sure. Well, thanks so much for having me. I'm really excited to be here as we look ahead to reopening for pre-K and students in cluster programs on Monday. And thanks everybody for joining today. It looks like we're up to about 90 something people joining, which is fantastic. So I'm Bryan Stokes. I've been now with CPS since May of last year. Previously worked at Illinois Action for Children, leading their early childhood programs, and I'm really excited to be here at CPS, leading the great work that we have, supporting early childhood programs across the city. So looking forward to the conversation today.
Yeah, thank you, Chief. And I think you guys have, you and your team put together a little presentation for us before we get started with some Q&A. So,
We did, yes. I think somebody has that.
yep. And I think our colleague Arthur is going to put it up. Yep.
Okay, great. So we want to just sort of walk through briefly before we get started what reopening will look like and some of the key questions about how reopening will work and how we prepare. So next slide. Just to start off, as I mentioned, our students in pre-K programs and in our moderate and intensive cluster programs will return on January 11th. Staff in those programs returned this week on Monday. And then our K-8 students are returning February 1st, and the staff supporting those students will return January 25th. And as there have been a number of press conferences and events, and so as Dr. Jackson and Chief McDade have reiterated in all of those conversations, our focus is equity as a district. Equity is wrapped around everything that we do. And equity is sort of the imperative for our reopening. We know that obviously needing to close schools last March was not in anyone's plan, but it was inevitable and unavoidable. But now that we find ourselves in this space, it's urgent that looking at the data, looking at the students who are not being served or not benefiting as much as needed from remote learning, that we bring back the students that we're bringing back. Next slide. And so, as we look ahead to reopening, I just wanted to kind of start with the number of students that are returning. So right now we're anticipating around a little under 40% of students who haven't expressed an interest in returning. And so looking at our pre-K students this year, we have a little under 17,000 pre-K students district-wide, and of those, 6,470 have chosen to learn at school. So that's the population of students that we are looking to return on Monday. And then we know about 10,000 students will continue to learn at home. And we know that teachers have been doing an incredible job of supporting students who are learning at home. For pre-K, learning at home is a mix of real-time live instruction, about an hour of live instruction and 90 minutes of asynchronous instruction. And so that will continue. We know that those students will continue learning alongside their peers who are learning at school. Next slide. So I know there have been a lot of questions about what this looks like, right? So now we're reopening school buildings for the first time in nearly 10 months. What will this look like? Students will at the beginning of each day, families will complete a symptom screener for every student, and students will bring a cloth face covering. Every student is going to receive 3 cloth face coverings on that first day of school. Those students who travel on the school bus are going to wear those on the school bus heading to school, and students will be spaced safely on the school bus. And then when students arrive at school, drop-off times are staggered. So students aren't all crowding in at the same time, but schools are going to use multiple doors. They're going to have a plan for keeping students separate and keeping pods of students separate. When students enter the building, they're going to have their temperature checked. They're going to wash their hands or use hand sanitizer and then begin their day. Next slide. So students are going to go directly to their classroom. One of the key parts of our plan is that students remain with their pod the entire day. And so when Dr. Fox has his session in a few weeks, I'm sure he'll talk about the integrity of the pod, that this whole idea that we're keeping students safe by keeping each group of students separate throughout the day. Students will eat meals in their room and they'll stay with that pod the whole day. In the classroom, students and teachers will continue to wear masks. There will be some teachers or staff who may need additional PPE, but most will wear masks. And then social distancing will occur as much as possible in the classroom and outside of the classroom. Each group of students will have designated bathrooms, which will be cleaned throughout the day. And students will be encouraged and taught how to wash their hands or use hand sanitizer throughout the day. Losing my slides here. Okay. And then, as I mentioned before, students will either eat lunch in the classroom or they'll eat lunch, separately as a pod in the lunchroom. And again, those spaces being cleaned throughout the day. Next slide. So we know that some of our students, receive additional services throughout the day, whether it's English learner services, diverse learner services, etc. They'll continue to receive those either in person from a staff member who rotates across the pods or remotely. And so each school is creating a plan to make sure that students continue to receive all of their services. And then students are going to remain in their pod. Again, whether or not there are other subjects brought in, students remain consistently in their pods. So students are never mixing with other pods. At the end of the day, students will move to their assigned exit door at their assigned exit time, through the halls, again, staying distant from other pods and leaving through the assigned door. Our goal with the symptom screener and temperature check is that any students who may be ill would obviously be identified before they arrived. But in the event that a student exhibited symptoms during the day, every school has designated care rooms that are safe staff spaces where students would wait to be picked up. Next slide. So grading and attendance. So teachers will continue taking attendance at the beginning of each day for children who are learning either at school or at home. And so, for students learning at home, whenever that real time, that synchronous instruction begins, that's when teachers will take attendance. And then, for early childhood, grading takes place using our assessment tool, Teaching Strategies Gold. And so teachers will continue, as they have been this year, using our research-based assessment tool and providing parents with updates on developmental milestones. Next slide. We've created a number of guidance documents and supports for families as well as for our teachers and staff. And so I believe in the chat, someone will place, if it's not there already, a link to our reopening website. And so I really encourage families to take a look at our reopening website, take a look at our guidance, our reopening guide for parents. We have remote learning guidance for families as well. And there's a wealth of resources for families there. Next slide. And so health practices. So obviously, with returning, to ensure that we're returning safely, we have a number of health practices that we now need to follow. And so, our custodial staff have all been trained, and I know Clarence will talk about this next week. Our custodial staff have been trained on CDC guidelines to sanitize classrooms. Teachers will ensure that tables and chairs and classroom materials are cleaned on a regular schedule. Students and teachers, again, will wear face coverings except when eating, when outdoors and socially distanced, if playing musical instruments outdoors, or during quiet time during naps. So, students will rest, several feet apart and will not need face coverings during nap time. But outside of that, students and teachers, again, are wearing face coverings. Staff will practice and model social distancing. So we in the Office of Early Childhood have created a number of tools and resources for teachers to help them learn about health practices and help them model appropriate social distancing. There will not be visitors or caregivers allowed in buildings. So again, schools are really going to limit the number of people in buildings and especially the number of people coming in contact with any pod. And so it really is that we're reducing the number of contacts as low as possible. And then for our half-day classrooms, we have a number of half-day preschool classrooms across the district. Those schools have scheduled additional cleaning time, so we'll have 90 minutes, and our facilities team has a protocol to make sure that adequate cleaning takes place between those sessions. Next slide. I do want to say, so I think there's been a lot of conversation about, well, what will this look like? A lot of fear about how classrooms will be designed to allow for social distancing. As a district, we made a decision at the beginning of the year to limit the number of students who would enroll in preschool classrooms. And so we capped capacity at 15 students. And so that allows us to maintain additional distancing as those students come back into buildings. And so the goal really is that pre-K classrooms look as normal as possible. That the environment continues to be structured around the essential elements of the day, continues to be structured around kids learning through play, learning through experiences. There are some changes. So our half-day classrooms will not have rugs. So if there's carpet installed, that stays, but rugs will be removed from half-day classrooms. In full-day classrooms, those will remain. Teachers are going to, design their classroom to reduce the number of spaces where kids are working and playing in tables and centers to promote distancing. We've supported teachers in ensuring that there's guidance to declutter the environment. So, we don't want large numbers of things coming out, but where it's possible to remove unnecessary items and make sure that kids have space to move around, that's really critical. We've removed items that can't be cleaned after each use, so or can't be cleaned on a regular basis. So things like stuffed animals, sand tables, etc. Items that can't be cleaned on a regular basis will be removed. And then teachers are planning for how their day will work with social distancing in mind. Next slide. And this sort of reiterates that, again, our before and after examples look much the same. And this is a very rough draft example of what this could look like. But the idea is we're providing more space for kids to move around, but we're not taking away what makes early childhood classrooms so special. We're not taking away this idea that kids will continue to learn through play and learn in ways that are developmentally appropriate. Next slide. Part of ensuring that the environment is healthy and that students learn about health and safety practices is these instructions and routines. And so, teachers are going to help students learn new routines, learn new practices, learn how to distance. There'll be books about hand washing. And so all of this will be, kids learning about and learning how to stay healthy, as we hopefully find ourselves in the other end of this pandemic soon. Next slide. We're also going to put in the chat here, there's a great tool that the Illinois State Board of Education has sponsored called Chat to Learn. It's a tool developed by the University of Chicago. And so really encourage families to sign up for it. We can send out, if anyone wants a copy of the flyer, we'll make sure those are linked as well. But it's a great way to learn some quick tools and tips and strategies to support preschoolers at home through daily conversations. And it's available in both English and Spanish. And so really excited about this tool that's available through the end of the year to any preschool family in Illinois. So please help us spread the word. Next slide. All right, I think this is our last slide here. So there are some great ways for families to reach the district, to reach Office of Early Childhood, to engage in Parent University. And so I believe we'll put all of these in the chat as well, but wanted to share ways that you can always reach someone who can point you in the right direction and get information and feedback, because we know that this is a challenging time. There are a lot of questions, and so here are some ways to reach us. I think I'm out of slides, right? Okay, well, great.
Fantastic. Thank you, Chief, for that information. There's a lot of information, so I'm going to let people take a second to kind of digest all the info that you gave us. I know it's a lot, and as parents, we have a lot of questions. So to start, some of the parents and community members who registered for today's event submitted questions ahead of time. So we're going to start with those. With you, and I'm going to give you a couple questions, and then you can give us some of those answers. So to start with, one of the questions parents submitted was, why are pre-K students the first to return if they do not know how to social distance?
Sure, that's a great question. I think a question that has come up a lot. So I'd say first, what our data shows is that our pre-K students and our students in cluster programs have been the least engaged in remote learning. So we saw both declines in enrollment for our preschool students. We've also seen lower attendance and engagement data. And so we're not reaching the students who we most need to reach. We believe that early childhood is a critical foundation for school success, and yet we're missing out on the ability to reach students who aren't showing up. I would also say that community-based early childhood programs in Chicago, across the state, across the country, have been operating essentially since the pandemic. Even as the district was closing, there were still programs that operated under emergency licenses. But when you look at the programs that started opening again in the summer and in the fall, actually kids are able to follow these rules. Kids are able to adapt and learn how to wear face coverings throughout the day. They're able to adapt and learn to not touching their friends, not touching their teacher. They're able to adapt and learn how to social distance. And so I think our job is to make sure we're supporting teachers in having the tools to teach those strategies, to teach those practices, but kids absolutely can do it.
Thank you, Chief, for that. I know you mentioned in your presentation, there's going to be a lot of play and teaching, right? To do the social distancing, is wearing the mask. So there's going to be a period of learning, I think, with the teachers and the students to come to a place where we're all wearing our mask and staying apart as much as we can. So thank you for that. One of the other questions that we have is about the teachers, right? Will the students have their same teacher? I think that's a concern that a lot of parents have shared with us.
Absolutely. So I know that principals have been working very hard over the past several weeks to figure out their plan for their building. So, there are a lot of variables and every school is unique. So the number of students who may have opted for in-person learning varies significantly across schools. The number of teachers who may have been approved for accommodations varies across schools. And so I know that principals are doing everything they can to keep classrooms together, to keep classrooms with their same teacher. But there will be instances where students may have a teacher other than their normal teacher, and principals will communicate those with families. And that's just to ensure that every student receives the best instruction possible within the realities of that matching process that principals have been are really putting a lot of work and energy into.
Yeah, thank you, Chief, for clarifying that. On that same note, we did get a question about pre-K students going full time and why that is. Can they opt for the hybrid model, right, where we have AB? Can you talk a little bit about that?
Sure. And this question's come quite a bit. So, again, at the beginning of this year, when we set 15 as the cap for preschool, we did it under this idea that we wouldn't then need to bring preschoolers back in a hybrid model. So that was very intentional, knowing that there would be a need for some social distancing to occur. The hybrid model is really designed around, looking at our K-8 students who are returning in February. Those classrooms are larger than the pod size of around 15 that we're trying to maintain. And so that's why we need to break those classrooms up into an A and a B model to ensure that the pod size is always below the number we're going for. I would say also, the part of the idea of the hybrid model is that students have this all remote day during the day, because the amount of time that we expect for live instruction for kids in that K-8 space is higher than what we're expecting for preschoolers. And so, there's a need for additional time and for teachers to have additional time for an all remote day that we don't have in preschool, where we're expecting that hour of remote instruction.
Yeah, no, thank you for clarifying that. I think that helps out. And I think on that same note, right, the concern with all students, I think it's the amount of kiddos that are going to be in those spots. So you talked a little bit about that, of you guys doing it in a way where there's no more than 15. Would some classes have less than that in the classroom? Can you talk a little bit about that?
Absolutely. So, I think for a number of reasons, yes, absolutely, there will be classrooms that have fewer than 15 students. So, if half the class chose remote and half the class chose in person, it's very possible then that the classroom would have fewer students. We also know that, this year enrollment in pre-K, and part of our impetus to return pre-K to in-person learning, that many parents chose not to enroll their students in pre-K this year because we started the year remote, because pre-K is an entry grade. And so there are classrooms that have fewer than 15 students enrolled where there will be fewer than 15. But 15 is the cap, and so no classroom would have more than 15 enrolled in person.
Awesome. Thank you so much for making that very clear. Is no more than 15, and some classes can have a little less, just depending on your school. So I think for parents, I think the note here would be like to contact your school, right? And try to talk to your administrator and figure out what the size would be for your specific students. So do that, call your school. And I know administrators are happy to answer your questions when you have that. So thank you, Chief. One of the other questions that a lot of our pre-K students or parents have is about the actual support they're going to be getting while in the building, right? So one of them was, will pre-K students be support while they go to the bathroom?
That's a great question. This is a question that really depends on the student. So there are some of our students who are students who have an IEP where toileting assistance is included in their IEP. And so those students will, of course, continue to receive that toileting assistance and support. And the special education classroom assistants who support them will have the specific PPE they need to be safe while helping kids with toileting. For students who don't have toileting written into their IEP, but who still need some assistance, in those cases, schools will work with parents. So then those parents would be able to complete the health screener, complete a temperature screen, and then assist those students. And that's normal. So, in a non-pandemic time, that's the exact same approach that we take. The parents assist those students who don't, have required toileting assistance in an IEP, while our SECAs assist those students who do.
Thank you. No, definitely. Thank you for clarifying that. So again, I think for parents, that line of communication with your school is really important, right? So if you know that your kiddo is still going to need help, start now contacting your school, trying to contact that administrator, right? To figure out a plan. I think that's key to being as prepared as we can for joining school, right? Thank you, Chief, for that. And I know you talked a little bit about what the classroom will look like. If you can talk to us a little bit more about that. Is it all the classrooms going to look the same? Is it the school is going to look different depending on the school? Just talk a little bit more about that, please.
Definitely. Well, I think every school is unique. And so every school is going to look different, is going to find, is going to get to the same goal of providing the healthiest and safest environment for students. They're going to get there in a different way. And so it is going to look different. What I would say is that we know that kids learn through play. We know that kids learn through experiences. And we believe strongly in what's developmentally appropriate, what's appropriate based on each child's age in terms of how they learn. And so classrooms are always going to be oriented around that. I think to the greatest extent possible, and again, I think we can do this because we lowered the capacity in classrooms for this year. We want classrooms to look mostly the same. Pre-K classrooms should still be very print-rich environments, should still be very welcoming environments, should still be environments where kids have a lot of choice in activities and materials and how they learn. And so that essence is not going away. How every classroom approaches kind of the safety requirements will look different, but the essence of still treating preschoolers as preschoolers doesn't change.
Thank you, Chief, for clarifying that. I think one of the other biggest concern, you touched a little bit about it in your presentation, right? When we're doing the health screening to make sure that nobody comes in the building that is sick or showing symptoms. And you talked a little bit about what happens if a kid starts getting sick in the building, right? So the question the parents have is like, what happens, right? Again, what are the protocols if a student does get sick? And in addition to that, like what happens to that classroom if it is a COVID case?
Absolutely. No, that's definitely a huge part of what our planning has been. I know that Dr. Fox will talk about this in his session. So in the event that a child becomes sick, that child then will go to the care room. So every school has a designated care room. I think some schools have multiple care rooms based on the size of the school. But the care room is designed to separate students who may be sick. It's staffed by someone who's been trained to be in the care room and to support and take care of kids and make sure they're comfortable. And so it's really a space where kids are going to wait separate from their peers until a parent or guardian or someone can come pick them up. And so the school is going to reach out to whoever's on that emergency contact list to come pick up the kid. I think what happens from there then, is going to be based on, what we find out about that individual child and what our health and wellness team then says. And so CPS has a contact tracing team that's going to figure out, who was that child in contact with if it is a COVID case. And then there's a set of actions that is based on, what that contact tracing says that will determine the actions to be taken, whether it's in that classroom or whatever it needs to be. And so I know Dr. Fox and Chief Carson will talk about that a lot more in their sessions, but there's an entire protocol of making sure that parents are notified, that spaces are cleaned to ensure that there's safety.
No, thank you so much for saying that. And I think to bring this up to the parents again, right? It's very important for us to have the correct information, right? Because you're talking about like, we need to contact you if you need to pick up your kiddo. So making sure your schools have your correct phone number, right? Like that emergency phone number if we can't reach you, or that email to keep you updated. So that's something that we can do now, right? If you're not sure if they have the correct information or you changed your email, because a lot of us do that and we're not receiving the information, right? Contact your school. I know the clerks are there and they're able to take that info over the phone and just update the system so that we have the correct information in case your kiddo does get sick. We're able to reach you as fast as possible and let you know what's happening. So thank you, Chief, for that. And staying in line with that, I know you talked a little bit about cleaning and the protocols for that. Some of the parents were a little worried about, because in the pods, we have the A and B, and then we have that one day where nobody's in the building, everybody's doing remote on Wednesdays. So there's that day where like it's mass cleaning. So what does that look like for pre-K if they're going every day into the classroom?
Absolutely. So I think there's a few things. So cleaning, definitely looks different for the classrooms that are hybrid because you have two different pods. And so if you have an A and a B pod, you've got two different groups of 15 students. And so, the type of cleaning that should happen between those pods is different from a pre-K classroom where for the majority of our classrooms, you have the same group of teachers, same group of students every single day. Our half-day classrooms, again, are going to have that, cleaning and sanitizing happening in the middle of every day between pods as well as at the end of every day. But all of our classrooms are going to be cleaned every day. And so I know that Chief Carson will talk about the custodians and what they're going to do and how they sanitize, but that's baked into this plan that there is cleaning happening. And then teachers and teaching staff are going to design a schedule around how they'll make sure that the toys, manipulatives, I can't say that word today, all the other items in the classroom are cleaned throughout the day. And we're following the guidance from the CDC in terms of how you make sure that things are safe. Removing the things that we can't clean, knowing what things aren't a concern, and then making sure we're cleaning those things that are.
No, thank you for that. I think that's a concern, especially with the little kids, right? That we like touching stuff. So I think it's great that you're letting us know there's going to be constant cleaning with kids who are moving around. So thank you for that, Chief. And in staying in that same line, I think, at the beginning of the school year, we always get a list of supplies that we need, right? So a lot of the parents are asking for safety reasons, would the kids need additional supplies, or what would they need as they come back for in-person learning?
That's a great question. So I would say schools set those lists of classroom supplies, and so schools are going to individually, and again, as you mentioned, that communication with the school is critical. Schools will indicate if there's a supply list for students. But I think it's important that parents know that every classroom is going to have a supply of the essential cleaning items. So hand sanitizer, disinfectant wipes. Every student is getting those cloth face coverings. Schools will have the disposable face coverings in case a kid forgets it one day. And so all of that stuff is already going to be at the schools. That's not something parents should worry about needing to bring in.
Fantastic. Thank you. I know it came up too when we were talking to Dr. Chavarria, because parents, as I'm a parent, we always get that list. So I want to make sure that we're ready for those who are sending their kids back. So thank you for that. One of the other, I know you talked about what the day would look like, right, for us to understand what our kids are going to go through. Some parents want to know the perspectives in the eyes of a student, right? Like what are they going to see? Are they going to have that interaction with you're talking about, play and learning with their peers? So what would they look like to them?
Yeah, no, that's a great question. So I think kids have already adapted, right? So everyone has already been through what we've all gone through since last March, and so I think collectively, kids adapt and learn about what's happening much faster than adults do, right? I mean, you don't have kids that are marching around Target saying that it's their right to march around without a mask on, right? That's not happening with kids. So I think what's important is that kids are going to learn about different practices. Teachers are going to teach kids about, constant hand washing, about, not sitting right next to their friend while they're reading a book, about not touching their face, those sorts of things. But at the same time, they are still going to have an opportunity to interact. They're still going to have those critical conversations with other adults, with other children, that in many cases kids have not had, right? We know that many kids may only have seen their siblings and their parents since last March. And so there's still a tremendous benefit. They're going to be able to experience story time in person. They're going to be able to, explore in the science area and build with blocks and, race cars on the carpet, et cetera, right? They're going to put puzzles together. All of these experiences, all of the activities and lessons that teachers create, teachers are still going to create, studies around learning about plants or learning about, sea life, et cetera, and kids are going to learn through those. So there will be differences. At the same time, kids have already adapted to many of those differences. And the tremendous benefit of being in a classroom setting, being able to engage with the teacher directly for a full day is still going to be tremendously beneficial.
Thank you, Chief, for that. I think for parents, it's important, right? Like, what are the kids going to see? How are they going to feel, right? We want to make sure that the munchkins, as I call them, are happy and that they're coming home and they're leaving if they're going to school excited, right? To learn in a school that some of them might have never been in, right? So I think that's key. Thank you so much for that, Chief. I think I still have a couple more questions that we're going to go through that people submitted. But before that, I want to make a small pause. And in the chat, one of our colleagues is going to put the information for our next session with Dr. Fox for those of you who are interested in knowing more about the health protocols and all those good stuff. So we're putting it in the chat. And then we're also going to open the chat. In case we haven't answered your question, you still have follow-up questions to what we said, you can put it in the chat. We're going to open it up for that. But just know we still have a couple more questions from the folks who send it through their RSVP. So we might not be able to get through those, but we will have a Q&A posted on our website with all of this information, and then the questions that we get from the chat today. So I think we're opening that up now. I'll give a few minutes for that to happen. Okay, so we have, I think, two or three more questions that were done ahead of time. So one of them that I really wanted to ask you was, for those parents either not sending their kids back or sending them back, what kind of support do we have for those? Where can these parents reach out? I know you put information in the chat, but what else can they do? Who can they reach, and how do they do it?
Absolutely. And you're saying support around registration for next year, or support around?
Yeah, and like, how do they support their kids at home with learning, right? A lot of us are not teachers, so like we're trying to support our kiddos. So like, what can we do? Where can we get some like best practices to support our kid at home, or even when they go back into the classroom?
Definitely. So I think there are a number of resources. I would say first, your child's teacher, right, is the first best resource. So teachers have been doing, incredible work creating those asynchronous materials, creating those take-home materials, take-home kits. And so teachers have a wealth of resources to share. I would also say that the Chat to Learn program that I referenced earlier, and I think Arthur listed in the chat, is a great resource. It's going to send you by text message on a, I can't remember if it's daily or weekly right now, but on a regular basis, text messages of great activities to do, great ideas of how to support your child's learning that you can do at home, and great conversations to have. And I would say as well, we have, and we can either put it in the chat or send it out later. But the City of Chicago, CPS, in collaboration with the Department of Family and Support Services, created something called Pre-E-Learning. And so it's a whole set of great resources and tools that are free to parents, available online, English and Spanish.
Fantastic. Thank you so much. So yeah, we as a team will make sure that you guys who register, we have your emails, that we send out that information. And then obviously feel free to share that out with your communities. The more we share information, right, the best, so that all the parents that were not able to join us, if you know them, send them that information. So thank you, Chief. I am going to move to some of the questions in the chat, because I know that there's a lot. So I want to give opportunity to those folks. So one of the first ones that we have is, parents, some of the parents at the beginning were just saying, we don't want to send our kid. So if they change their mind, right, and now they want to come into the classroom, is there something they can do, or how would they work?
Absolutely. So I'm not sure when we'll have sort of information out about that process, but the idea is that at the end of each quarter, that families can change their learning preference to learn in school. So families can choose at any time to switch from in-person to remote. At the end of each quarter, they can switch from remote to in-person. So I think hopefully we can track down exactly what that process looks like. I'm not 100% sure, but I know that will be an option. I would say to connect with your child's school, so that they're aware that you're interested in making that switch, so they can get you the information.
Great, thank you. Yeah, so again, it's that communication at the school level, right? Making sure that you guys as parents have that phone number, that email, and ask questions as much as you can for information that you need. So thank you, Chief. One of the other questions that we have, it's about, CPS is providing the mask, the cloth mask, right? That can be reusable, or some parents already have their own. How are we guaranteeing or teaching the families, right, that those need to be clean, that they need to come to school with a clean face cloth every day?
Absolutely. So, I believe every student receives 3 at the beginning of when they return. And so, I think part of the communication that's going to happen between teachers and parents, between schools and parents, is about the importance of bringing in those face cloths, but also the importance of cleaning them. And so, the idea is that there's enough there that families can rotate them and make sure that they're clean on a regular basis. And then, of course, for emergencies, schools are going to have a limited supply of disposable face coverings. So it's not like, the kid, wouldn't have, anything in the event that, say, becomes dirty somehow or something. But, that communication between the school and the family will be critical around that.
Yeah, absolutely. So again, right, we keep re-emphasizing that, like, communication with the school, especially with the teacher, right, since she or he would be in the classroom. There are some questions about health risk, and to those folks who put those in the chat, I want to be respectful of your questions, and we're going to save them. But I do want to make sure that we ask those for Dr. Fox. We want to make sure that you guys do get information, correct information. Not that we would give you bad information, but I want to make sure that is the correct information for your questions. So if you type some of those infos or some of those questions in the chat, we are going to save the chat, and when we come back next week with Dr. Fox, we will ask some of those questions to him directly. Okay, so I don't want you guys to think that I'm skipping. I am seeing them, but I want to make sure that we ask the correct person for those very specific health questions. We do have a question about what kind of support or training have we given teachers? I know you talked about if it's on the student's IEP, they're able to, support him in going to the bathroom. But with those other kiddos that still need support with, like, zipping up their jackets, right, tying their shoes, hanging up their jacket, has there been any training or support to teachers on how to handle that?
That's a great question. So I would say, we have a lot of guidance around health practices. And our office, my office, the Office of Early Childhood, provides a team of staff who are in the networks who are able to support principals and teachers as questions are coming up. And we've had quite a bit of training over the past few weeks. I mean, over the past year, we've had a lot of training, but in the past month or so, especially, training, prepping for reopening. So training on those health practices, training on those environmental practices. So teachers have received quite a bit of that. And we've got some mechanisms within CPS where teachers are submitting questions. They're coming in all the time, and some come to me and some come to my staff, and we're getting responses back. What I would say about some of these questions is that, again, we really have looked at, the early childhood system as a whole. We've looked at, community-based early childhood settings that have been in operation and have been able to do this successfully and safely. And so those practices are the same that we're going to really look at and adapt here. And so, I think it seems very, very foreign, but really a lot of what's going to happen is the idea is that it should look as much as possible like a normal school day would.
Yeah, no, absolutely. And I think as parents, something we can do at home is practice those things with the kiddos, right? Maybe the kids, I know, like, my kid took forever to learn how to tie his shoe, right? So that can be something, as parents, we're asking about supports, right? Like, those are things that we as parents could do at home, practice, even though we're not going out anywhere, putting on your jacket and trying to zip it up, and just learning, starting the learning now at home before we get to the class, especially with those kiddos that never been in a building. So I know it's scary for the munchkins. So it's something that we can start having those conversations. I'll try to ask your staff if there's any info that we can send out with, like, flyers or, like, to do with pictures for the kids, so they can learn, like you said, through playing, right? And then they might not be fully ready, but a little bit more ready when they get to the classroom. So I made a note of that, and I'll ask your staff to send us that, and we can share with the parents. So thank you, Chief. One of the other questions that we had, it's about those the integrity of the pods, right? If we have resource teachers that need to see a kid in the pod, are they going into the classroom? Are they seeing kids in other pods? How does that work?
Absolutely. And so, there is, I don't remember the exact number, but, those professionals will rotate across pods to provide the services necessary. So, if it's, speech services, or if it's social emotional learning services, those professionals will rotate across the pods because it's only, that individual wearing a mask, still maintaining appropriate distancing, that is still, safe. And so that individual is going to be limited to a certain number of pods that they will visit only for that service. Outside of that, if in the event that we have someone who would need to visit more than that max number of pods, those services are going to be remote at that point.
Okay, sounds good, Chief. Thank you so much. I think we have time for one more question, and then we just want to do a quick recap of what you want us to, the three things that you want us to leave with. But I do have our last question. And again, I apologize for everybody. I know you guys are putting a lot of questions. We have tons that I haven't gone through. We will do a Q&A and try to answer those and post them on our website. And then I will personally send you guys the link to that question or to that Q&A, as I did today with the link. So bear with me as we get those things ready. But one of the things that we're talking about here is about the kids where it's a smaller classroom. Let me see. So for those kids that are, it's a smaller, we said it's not 15 kids, it might be smaller. Would they be able to go then Monday through Friday instead of the hybrid? But I think all pre-K is just Monday through Friday, right?
All pre-K is Monday through Friday. I do see that's a question about kindergarten. And so, again, schools are making individual decisions based on, their staffing plan and based on the number of students who are attending. And so, some schools may be able to have kindergartners attend more frequently. Excuse me. But that's going to be an individual school level decision. And so, staying in touch with those principals is key.
Yeah, definitely. So depending, like you said, how many students are in that classroom, how many students are coming back, correct? So again, touching bases with your administrator at your school level and seeing if they should already know how many kids are coming back and what their plan should be. So definitely reach out to your school at the school level. And again, guys, I'm so sorry we're not going to be able to get through all your questions. I have about 30 that I haven't gone through. So I apologize, but we will put a Q&A together. I will send you that link, and then all the links that were put on the chat, I will email them and share those with you. To end our discussion, I do want to give you, Chief, the last couple of minutes. And thank you for the information that you're giving us. I know it's a lot, and as parents, we're taking it in. What are the three major things that if we forget anything from today, what are the three major things that you want us to take home with us?
Absolutely. And no, there have been so many great questions. And so looking forward to us being able to answer more of them. I think the three key things are this. I think first, every school is going to look a little different, and principals have been working tirelessly, and teachers are working tirelessly to develop plans that are going to make sure that kids are learning, are gaining as much as they can, whether they choose in person or at home learning, right? And as healthy and safe as possible. So, I think first is stay in touch with your principals, stay in touch with your teacher, and really do reach out with these questions, because they're going to have the answer about. I can give sort of the overall answer, but the answer about your building is going to be from your school. I think second is that young children are incredible learners. Young children are capable of adapting in incredible ways, and we've seen that from the ability of our community-based early childhood settings, across the country that have been able to operate and have been able to implement health practices in a safe way. And so I think knowing that it's going to look different. It's going to be an adjustment and an adaptation. And there are going to be some challenges that come up along the way. But this is possible. It is possible for students to learn how to adapt to these health practices. And then third, I think is, we've got great ways of getting in touch with the district that we shared in the chat. We can share it again when we send out this, this presentation. But, I think there's a lot of, I know that there's a lot of concern and a lot of questions and a lot of information that floats around. And really, we as a district are very open to answering those questions and sharing information. So please reach out, I think is the third key item is please continue to reach out. This isn't the only opportunity, and really continue to share those questions with us.
Fantastic. Thank you so much, Chief. I appreciate you giving us your time, your expertise, and being really clear as to the answers that you gave us for the parents who asked all these questions. I appreciate that from you. Thank you so much. To the parents who joined us today, thank you so much for giving us Thursday afternoon of your time. I know it's been a crazy week, so I appreciate you guys being able to join us and ask those questions. Sorry for those of you that I wasn't able to get to your questions. We'll definitely put the Q&A together and send it back to you guys. I will send out an email by Monday, hopefully, with links, and then give us some time to put these Q&A together. So please give us a couple of days to put it together, but the rest of the links I will send by Mondays, just so that you have it. And don't think I forgot about it. So make sure that you guys check your email. And again, update your information with the school. Make sure that you guys are up to date with all the information. Visit the CPS website, cps.edu. I know there's a great video on the main page about what a day will look like for pre-K. There's a couple of schools they were able to show us. So please look at that if you want to see it live or live in video. So make sure you guys do that, and also visit the CPS reopening website where there's a lot of this information and we continuously update that. So make sure you visit that. So with that, I'm going to close the meeting. Thank you so much, everybody, for joining us. Chief, thank you so much. Thank you so much for the staff that's been supporting us and helping us with the interpretation and opening the chat. Thank you so much, guys. Have a good night.